Mr Speaker, my question is to the Acting Premier and Minister for Health. Minister, another Tasmanian has died from COVID overnight. May they rest in peace. As at today, there are 2,009 reported new cases. Minister, 48 hours after the mask mandate was lifted on 11 March, reported COVID case numbers had doubled to over 1,800. In response to this clear cause and effect, your colleague, Resources Minister Guy Barnett, told Tasmanians, and I quote, "This slight uptick in case numbers," narrator, it was a doubling of case numbers, "is not related to the recent removal of masks." The Greens believe this was a blatant falsehood. Minister, did Public Health tell you the doubling of reported cases within 48 hours after masks were removed had nothing to do with lifting those protections?
Honourable Minister for Health and Acting Premier.
There's one question in that question.
Very long.
Mr Speaker, Ms O'Connor, Mr Clark, thank you for your question. In your question, you acknowledge the passing of another person.
Another avoidable death.
A 94-year-old woman who was
Premature death.
in residential aged care facility in the state's north and sadly passed away. And my thoughts and condolences to the person's family, friends and loved ones. Ms O'Connor, as the Premier has said many times in this place and publicly, and when I speak about publicly, have been very transparent in the approach that both himself, our Health Commander, Ms Morgan Wicks, our Director of Public Health, Dr Mark Veitch, have been in terms of their public presentation and their transparency when it comes to informing Tasmanians over a very long time now. Goes back to February, March 2020.
We know what they said about the
Ms O'Connor, order.
2 years of intensity in terms of decision making, the variables of the COVID-19 variant to begin with, Delta, Omicron, BA2, which as we know is more transmissible, but all the evidence would suggest no more lethal in its effect.
How would we know? It's only been around.
Order. Ms O'Connor, that's twice.
And this has
Third time
challenged
and you're out.
our state and it's challenged the nation, and indeed it's been challenging across the globe. But the Premier has said that he has been...
Point of order, Mr Speaker. Standing Order 45 relevance. You've given guidance before when there are a number of questions in the question that the Minister has latitude. We asked a single question. Did Public Health tell you the doubling of reported cases within 48 hours had nothing to do with the... I'm entitled to give a point of order in silence.
Order.
One question in the question. Did Public Health tell the Minister the doubling of reported case numbers had nothing to do with the removal of masks?
And Ms O'Connor, I'm sure the Minister heard the question and he has to be afforded the opportunity to answer the question in full, without interjections and without points of order.
So you're going to warn
Honourable Minister.
Just answer the question.
The point I was making, Ms O'Connor, is that unlike other states, the Premier and the team at Public Health, who have done such a wonderful job, have been joined at the hip when it comes to our response to COVID-19.
Yeah, that's right.
And across our THS, Ms O'Connor, the work that has been done around vaccinations, where we still lead the nation in vaccination, Mr Speaker, and particularly when it comes to our 5 to 11-year-olds, consistently 10% above the national average, although it has plateaued, and we need to encourage parents and carers, of course, to get their children vaccinated, because it is the number one protection and the number one defence. there have been various public health measures along the way, going from the extremities of lockdown to restrictions, to including masks, of which, of course, we're still complying with, and is restriction within our place of work here today, Mr Speaker. We will always take the very best of public health advice.
Mr Speaker, at risk of irritating you again, point of order 45, relevance. The Minister was asked one question.
Very high risk.
I'm not finished.
Ms O'Connor.
I'm listening to you.
The Minister was asked one question. I implore you
Ms.
to
O'Connor.
ask him to answer it.
Ms O'Connor, as has been answered plenty of times in the past from the speakers of long gone, that there is leniency given to the member asking. There was a significant preamble to the question, and the issue has been addressed by the Minister. I can't put words into the Minister's mouth, and you, of course, obviously have a second opportunity today to ask another question if you wish. So, Deputy Premier.
Thank you, Mr Speaker. Of course, it should be known as well that our restrictions have eased due to the good, solid public health advice which we've been guided across the way, and it should be noted that Tasmania has one of the, if not the lowest hospitalisation rates in the country. We have managed the pandemic extraordinarily well.
Rubbish.
Largely with the support, a tripartisan support across this Parliament until recent times, Ms O'Connor. From the extremities of border closures and lockdowns, particularly in mine...
Ms O'Connor, you're on thin ice.
...neck of the woods, to the easing of restrictions given the mild nature of the Omicron variant, albeit more highly transmissible, and of course the BA2 more highly transmissible than the Omicron that first reached our shores late last year, as I understand it, Mr Speaker.
I need to ask the Minister to wind up, please.
Ms O'Connor, we have followed public health advice along the way. We've been one of the very few states to do so in lockstep in terms of policy between the Premier and indeed public health, and that will continue.
Answer the question.